So the motivation for our research project was really to better understand, capture, and then mitigate the common barriers that face Medicaid-eligible non-citizen children when they're trying to enroll in Medicaid.
One of the main motivations for me to undertake this research project is to make sure that all children have access to the care that they're entitled to. And we know that Medicaid benefits children and families in many different ways. They are healthier, they have better educational outcomes, their families have less stress about accessing care, more likely to have a primary care provider. These are benefits that these children are entitled to, and I want to make sure that they're receiving those, really trying to get the best health and quality care out to these families so that they can thrive.
I'm an attorney in town, and I work at a nonprofit called the Legal Aid Justice Center. And in my work, I kept finding that kids who were eligible for Medicaid but were not citizens, so had various immigrant and non-immigrant statuses that the law says are eligible for Medicaid purposes, kept getting denied by the state when they tried to enroll in Medicaid. And I knew that was just while that pattern was consistent, it was a small fraction of probably the experience of lots of kids in the non-citizen community, many of whom probably didn't know that they were eligible for Medicaid in the first place.
One of the main things I'm interested in is the utilization patterns, the healthcare utilization patterns. Really interested in how many of these families are using the emergency room as their primary healthcare provider, how many of them actually have their own primary care provider, how many of them have foregone care because they did not have Medicaid in place for their child, and so they skipped well visits or sickness until it couldn't be avoided any longer. So by following these families over time, I'm hoping that we can see some impact of having or not having Medicaid and maybe see those utilization patterns change over time.
We sort of had seen through our experience that commonly families who are non-citizens don't know that they're eligible for Medicaid. It's a very complicated set of regulations and policies that folks who may have language access difficulties or just may not have familiarity with the law, as many of us who aren't lawyers don't, right? Didn't understand that they were eligible for Medicaid. I think our hypothesis was also that there was confusion over those rules and policies, even at the state level and by folks who were enrolling eligible kids in Medicaid based on simply what I had seen appealing various erroneous Medicaid denials for kids who were non-citizens. And then, of course, we had another hypothesis that one of the common barriers facing non-citizen kids in the Medicaid eligibility process was fear in the immigrant community and in the non-citizen community, based on various federal policies. I think there was a well-founded fear that by trying to enroll your child in a program like Medicaid or other public benefits, you may experience, as a non-citizen, you may experience adverse consequences to your immigration case if you're trying to become a citizen eventually. And as advocates working alongside those populations, we understood that fear, whether or not it was going to come to pass, was rooted in it was a deeply held fear that oftentimes prevented eligible families from enrolling their kids in programs like Medicaid.
There is no data out there on these families as far as their Medicaid access. If you go through the literature, it's very hard to find very much information at all. So this is information that needs to be known. And I think the surprise is that the families really are willing to come forward and speak with us. And I was very nervous that because we're dealing with a very sensitive subject, that maybe families would be reticent to come forward.
We have developed a series of survey questions that ask participants in our study, and the inclusion criteria is, are you a parent or legal guardian of a Medicaid eligible non-citizen child? That's it, really. So we ask a series of questions through surveys of those family members about what the Medicaid enrollment process was like for them, whether it was difficult or hard. They get to rate their experience and explain why they responded in the way that they did. It asks them about whether or not they know what Medicaid is and if they had any help enrolling their child in Medicaid to the extent that they enrolled their child at all. If they didn't enroll their child in Medicaid, why not? It also asks about the parents' and guardians' perceived stress levels. So what's stressful to you about accessing healthcare, medical bills, finding a doctor, etc. And then it also asks questions about whether or not their children have a regular primary care provider, a nurse practitioner, a doctor, and what their healthcare utilization looks like. The idea being we want to sort of tease out any relationship, to the extent there is one, between Medicaid coverage or insurance coverage and access to and utilization of primary care services.
The funding has been great. It gives us the opportunity to pull this together and really make it happen. But iThrive has helped us in a million other ways. I think one of the biggest ways was the data collection tools and trying to figure out how to access REDCap and how to set up a survey tool that was effective and could be implemented easily. We have a team of students and residents who are working with us to gather this data. And so having the REDCap kind of computer-based collection tool allows us all to work effectively, even though we're not in the same place at any given time, and to access families when we need to.
Advice I have for other researchers or potential iThrive grant applicants would be to throw your name in the hat, particularly if you're not from a traditional research background. I myself, I'm a lawyer. I've never pursued serious research before, and iThrive will provide you with a lot of the mentorship that's necessary to do this well. I'm also lucky to have collaborated with a tremendous clinician, but also a physician scientist and a lawyer herself, Dr. Pappas. So I think, the idea that to approach research from a multidisciplinary lens so that you can harness each other's disciplines in the process of gathering the research to ultimately affect change in the way that you want to, in the case of our project, to make sure that the laws are clearer and better enforced, right? Better followed, requires people from multiple disciplines using their expertise to bring to bear about those changes. And I think I wouldn't have necessarily thought that research was a way to do that, but it's certainly given me lots of important data that I can then use as an attorney to more effectively advocate on behalf of my clients.
There's huge strength in community collaborations. Legal Aid Justice Center, Michaela and I have worked together for a long time. And there is a tremendous amount of power that we can harness by bringing ourselves together from two different disciplines. And I think we can have a greater impact by doing that. And so I would encourage people to seek out community collaborations as an incredible tool to help make change.